Basically, this is Trauma 101, improving trauma IQ, what professionals and caregivers need to know. So, I'm Thomas Threlkeld, and I'm with these wonderful kids out of Lutheran Family Services in Nebraska, and I'm going to be going over our project. In the fiscal year of 2017, 2018, there were 440,000 kids in foster care. In Nebraska, there were 3,700 kids in foster care. So when I started looking at some of these demographic numbers, I was, kind of trying to figure out who these kids in Nebraska were. And so what I found was that there's some real staggering disproportionality in Nebraska. In 2018, basically, non-whites basically face a much higher chance of being in care, and so they only represent 11% of the total population, but 50% of kids in care. So here's a little, I like the visual aids, they're better here. So total population, here we got, the 88%, non-white is 12%, but then making up 50% of care. And then on our next slide is a breakdown, basically, of what those populations look like. And so we've got the 50% white, 17% Hispanic, 16% African American, 9% multiracial American Indian, 5%. And so it's pretty clear, it's kind of evenly distributed between African American and Hispanic populations in Nebraska foster care. So in Nebraska, there's a 12% poverty rate. You're twice as likely to live in poverty if you are non-white. So basically, this is just a breakdown by race and ethnicity of your likelihood to live in poverty, basically, or of the distribution of poverty. Families who live in poverty are more likely to experience trauma, abuse, or neglect. They also are less likely to access resources that are related to trauma. Children in poverty have a higher likelihood of removal due to some reasons: substance abuse, neglect, unsafe housing, and lack of resources. Children in care not only experience the trauma of removal, but also have a high likelihood of experiencing trauma prior to coming into care. So when we talk about poverty rates, and we're seeing that they're higher among children of color, and then we're looking at removal rates that are also higher among children of color, we're basically making the connection between that these kids are much more likely to experience trauma. Because of disproportionality, the outcome of non-white children in care can be more impactful on communities of color. And this is something that me and Cheryl Lynn went around on because I was trying to piece this together. But basically, how can we ensure that one of the questions I wanted to ask is, how can we ensure that our positive outcomes are evenly distributed between children of color and their white counterparts as diversity within Nebraska increases? So if you see here, this is population trend, this is projected population distribution. And so, in terms of disproportionality with children in care, this is something that will intensify as time goes on, especially as our Hispanic and African American population increases. And so we have to make a conscious effort to make sure that those positive outcomes are shared by everybody, and that when we start, even if we're making changes in the system, that we're making sure that some of our most vulnerable and some of our kids that don't typically share the same rate of positive outcomes, or have access to that, or that we're making a conscious effort. And so that's what I'm basically saying, is that we just need to make a conscious effort to make sure that everyone is sharing the same success. So developing a question. So basically, I wanted to start off with trauma-informed care. This is a driving factor behind my presentation. Just because we always hear that it's such a buzzword, and everybody you talk to says it's a buzzword, and nobody actually seems to have a clear picture of what that actually looks like. And so a lot of people who are claiming they're trauma-informed aren't trauma-informed, and then there's a lot of people who are trauma-informed, they don't even know they're trauma-informed. And so I thought, with my project, that I wanted to kind of create some kind of framework or some kind of basic understanding of what that is. And so, experience as a professional, I've taken a lot of trainings in trauma specifically. I'm a foster care and adoptive parent trainer, and then also I was basically I've been working in the field for 12 years, and so I started my career in the very low trenches of enhanced treatment group home and working with some really, really, really difficult kids. And it's from there that I kind of grew these trauma-informed skills. Again, I had no idea what it was. I was just out of college, you know. I was like, well, these kids are cool, you know. I'm gonna just, you know. And so, you know, I used to love those really tough kids because they were fun to hang out with, you know. But I didn't know, you know, that's what trauma-informed care was. And so throughout my career, I've kind of really honed in on that. And as I've grown in terms of my learning about trauma-informed care, or learning what that means and learning the different models, I've been able to kind of incorporate that and create, you know, a way basically to put labels to the things that successful trauma-informed care workers are doing. And so why am I interested? I'm interested because I grew up in the system, and actually I never achieved permanency. I actually bounced around in homes from the time I was 8 till the time I was 18. And so this is something that was very close to my heart. You know, I was one of those reactive attachment kids. I was one of those kids, as I said, you know, wasn't going to really get anywhere. And so it took me until my late 20s to really sort through a lot of my own trauma and a lot of that stuff. And so all the pieces were there through my own experiences, my work experience, and my education to kind of piece together, you know, what that looks like, and really how I can use my experiences to help work with kids who, you know, are really having these difficulties and helping people understand where they're coming from. So the effects of trauma can contribute to disruption. In 2018, 35% of children in care experienced lateral moves, and this is in Nebraska, and 19% had placement moves away from permanency. So 20% of the kids in Nebraska had a permanency set up basically, and then that fell through. So then we get to the question, which is, if professionals and caregivers in the child welfare system receive more effective, efficient, and accessible training regarding trauma and attachment, will it improve their trauma competency or trauma IQ? So that's a mouthful. You know, that's got Cheryl Lynn written all over it. So I wanted to put it all together. I wanted, you know, she's good about reining it in because I was all over the place. So that's what we settled on, and it's still very Cheryl Lynn. So answering the question. So basically this is just the methodology, which is just define, explore, measure, action, access, and repeat, or assess and repeat. So I did a focus group with professionals. I did a literature review. I did a survey with professionals and caregivers, and I did a training for professionals and caregivers, and then I assessed that training through a retrospective survey to see what the effectiveness is. And so through that focus group, I'm kind of defining what trauma looks like, or what trauma-informed care actually is, and identify what's missing, and also defining trauma IQ. And then, you know, through these other pieces, basically, yeah. So moving on. We're going to go through it all anyways. That's just, yeah. So basically, identifying the gap through the focus group. So I completed a focus group with directors and supervisors, kind of a group of people from my agency, and that was for two purposes. These are the people that do the work and can make the connections to what I'm actually trying to figure out. But also these are stakeholders, and these are people that would benefit from a developed trauma training. So basically these are some of the answers they give. Some of the homes aren't required to take additional trauma training, even though we know it affects almost all of our kids. Classes are only offered after a behavior occurs. So we have some trauma training resources in Omaha, but you know, you won't hear about them until your kids, you know, going a little crazy, and just really having some serious behavioral issues related to trauma, and then all of a sudden everybody's like, oh, there's all these trauma resources. So trauma trainings can range from a 6-hour course to multiple days, and actually that 6-hour course that just happened within the last 6 months that they cut it down. Our shortest trauma training in the Omaha area was, I think, 16 hours, something like that, like 2 days. And then some, in our state, some professional and legal parties have limited knowledge about trauma, and so some of these people are not very trauma informed in their decision making, and so they're really having effects with some of the ways that they're handling some things in terms of their court involvement and things like that. And the big thing is caregivers and professionals don't always know what's missing from kind of their trauma informed. They don't know that they're not trauma informed, I guess is what you would say. Because of these factors, professionals and caregivers do not seek out additional trainings. Instead, staff fill in the gaps. So we've got foster care specialists, and we've got adoption specialists, and we've got different people basically helping to train families to become trauma informed after the fact. They also get a lot of information from therapists who are not fully trauma informed, or they may turn to their support network or friends. And then as a result, basically the trauma informed message becomes diluted, fragmented, or inconsistent. And so a lot of times they're getting bits and pieces, and we're coming in, and sometimes we're working through a disruption, and my jaw would just drop when I would hear like that they haven't heard some of these really, really, really basic concepts, and have a poor understanding of their own trauma and kind of how that's affecting the situation and things like that. So also through this focus group, we identified components, trauma IQ components, which were self-awareness, relational-based, perceptions of behavior, and nurturing versus authoritarian. So literature review, I won't take too much time on that, but we all know that there's a ton of research, Karen Purvis, Spiegel, Bruce Perry, just so much research out there. I mean, this is trauma-informed care is pretty much the standard. So some of the limitations are it's hard to define what it is exactly, that one size doesn't fit all with our children. It may narrow the scope of treatment for children. And there's difficulty in diagnosing PTSD. Trauma-informed care is overwhelmingly supported by almost everybody. I'm sure there's some people out there. I don't want to talk about that though. So I went through and identified within our agency what we were using, and we were in terms of trauma-informed care. So we used PBRI, we used some Bruce Perry, we used just some different basically model components from all of this hodgepodge stuff. And so again, fragmented message, all the same buzzwords and a lot of the same things, but it's in terms of putting it together with some clear, concise training, it's not, we weren't really there. So basically, so I wanted to start off as I went on this journey, and I said, how can we paint this clear picture for people? How can we bring all of this together into one magical, life-changing, world-changing, child welfare-changing training? So I was like, why don't we do a survey? So I developed an initial online survey. I sent it out to a bunch of people in my network, a bunch of people within my agency, and sadly, there was only a 10% response rate. And so I met with, I'm not going to say names, but somebody who is obsessed with surveys and loves surveys, and she helped point me in the right direction. And so there were some issues with my first survey. If you guys don't know what I'm talking about, so the first one wasn't anonymous, and it wasn't due through a website. I just kind of sent an email survey out. I've never done a survey before, so I didn't really know. But, and I required a lot of written answers, and apparently foster parents are busy. I don't know if you guys know. So basically we kind of revamped that. We sent out 200 surveys. We had a 25% response rate with 52 completed that second time around. But it was all fancy and survey gizmo. I don't even know what that is. There's cool buttons and stuff. So 37 foster parents responded, 15 professionals responded. 4 of them were child therapists, 5 child welfare administrators, 5 other direct care with children, and then 1 program support staff. And so the actual survey, so there were 10 questions in the survey, basic demographics, number of children worked with, perceived percent of these youth with disruptive behaviors, perceived percent of behaviors related to trauma, approaches and strategies, which was a qualitative question, formalized trauma training attendance, which is quantitative, if not, why, which is again qualitative, or is qualitative, perceptions of preparedness, quantitative, and then challenging behaviors, and what should be in a Trauma 101 course. So I'm going to these 52 respondents, which are professionals and caregivers, and kind of figuring out, okay, what should we put in this training? And so this is just a breakdown of the people who took the survey, so 52 total, and then I just went through the breakdown numbers on that, so we won't. So how long has, so my second question here, how long have you been working in the child foster care / foster care adoption field as a worker, foster care, adoptive parent, child welfare, or administrator, or other listed? Basically time spent, only 21% less than 1 year. And so that means that 80% of the people that took the survey were more than 1 year into working with kids. So that's going to be important a little bit later here. Average estimated of children worked with in that time was 138.6. Of course, I got those professionals on there who put like 10,000 kids they worked with, you know. So then I had to adjust that a little bit because I felt like my data was pretty skewed. And so it came out to 57.6 adjusted for people with over 500 plus, which were professionals. And so children, basically all of these people said that they feel like 61% of the time these children are displaying disruptive behavioral issues, or that disruptive behaviors, basically. And then my next question was, to what extent do you believe these disruptive behaviors were displayed by the youth were related to traumatic experiences? So 90% reported that they believe these behaviors were a result of trauma, quite a bit or to a great extent. 90% of people, that's also important, remember that. So then we got to the bread and butter, which was how many had taken trauma training. 66% reported that they had taken trauma training. Of that, so that was 30 people. So of these 30 people, 63% or 19 people could not recall what training or mentioned trainings that were not trauma focused. So again, unclear view of what actual trauma-informed care is. Pretty simple question: have you taken a class specifically for trauma? And then so after adjusting for this, 32% or 11% of respondents, or no, 32% or 11 respondents had taken trauma-specific training. So remember that 4 of the people that took this survey out of the 52 were trained therapists. So if we adjust for that, so excluding therapists, only 16% or 7 people were able to verify that they had taken a trauma-focused training. And so when we look at that, we look back at those other numbers that we were looking at. 90% of people reported that disruptive behaviors were a result of what they believed was trauma, and 60% believed that disruptive behaviors, or they believed that, or 60% of the time, disruptive behaviors were related to trauma. So 78% or 40 people report feeling unprepared some of the time or most of the time to work with disruptive behaviors. So 80% of the people surveyed felt some of the time that they weren't prepared. And then remember, only 16% adjusted of respondents reported taking trauma-focused training. So, and then I put coincidence, question mark, because that seems interesting, that 78% report feeling unprepared, and we only came up with 16% that actually had taken trauma classes. Get the old noodle thinking, huh? So challenging behaviors as reported by respondents. Verbal and physical aggression, 22 people reported that, defiance, non-compliance. 12 people responded with that. Problematic sexual behaviors, 7 respondents. Attachment issues, 3 respondents. My personal favorite, which is when you can't keep them in a building. That one person only responded to that though. These challenging behaviors are commonly related to trauma and may be more effectively addressed through trauma-informed care. And then I asked number 10, the big money question here, what topics or activities should be included in trauma one-on-one training? And the responses that identified trauma IQ components from the focus group. So remember earlier in the focus group, we had identified trauma IQ components. We had 2 for self-awareness, 5 for relational-based, perceptions of behavior 4, nurturing versus authoritarian was 0. So 20% of survey respondents included these trauma IQ components when asked what should be in the training. So I thought that was kind of significant. A high percentage did not always feel prepared to deal with behaviors. Many respondents felt that trauma played a role in a very high percentage of behaviors. Respondents felt like they provided trauma-informed care, and although trauma likely affects almost, if not all of our kids, the majority of percentage of professionals and caregivers had not taken trauma training. This survey reinforced the idea that foster parents and professionals lack trauma-specific training. So basically it told me kind of what I already knew and what I learned through the focus group and what I learned through my own experience of filling in the gaps as one of those direct care workers, helping families become more trauma-informed. Of those that reported that they had not received training, time constraints were noted as the #1 barrier. So I wanted to do a training, and I was like really excited about it. And so I developed an hour-long training was developed to teach the identified trauma IQ components, other basic trauma-informed care components, trauma in the brain, and a basic trauma framework to use when addressing behaviors. So time allotted for introduction and retrospective survey and it utilizes humorous visual aids, memes. I don't know if you guys, this guy says subconscious, why let me be happy. That's a good one. Scar, grab my paw, nope, emotional trauma. And physical trauma, because then he hits the ground. So that's a double whammy, that's a good one. And then that last one there, just because I'm mad at you doesn't mean I don't care or stop loving you. So this is just riddled. This training is just riddled with this stuff. And so the big thing was that I wanted to stick to an hour because I knew that we could do better than 6 hours. We professionals, especially legal professionals or caseworkers, judges, and a lot of caregivers, they're already attending the trainings that they have. Everybody's schedule's full, everybody's busy, and and I think that was one of the main things. So I wanted to be like, we can make an hour training, and we can get as many people there, and we can go over the basics. And so, my first one occurred during an initial foster parent training, and so there were 11 total participants, 11 total foster parents, or 7 foster parents and 4 professionals. And so then there was a 10-question retrospective survey, basically to measure, the trauma-informed care or trauma IQ components of knowledge. So there were 11 respondents, and we used measurements to illustrate knowledge gains. So no knowledge, some knowledge, and a lot of knowledge. So the results of the retrospective survey is that 91%, or 10 people out of 11, reported an increase in knowledge. 100% reported an increase in more than one area. 80% reported an increase in 3 or more areas. And 50% reported an increase in 6 or more areas. So I thought that was pretty cool. My 3 final questions. Measurements used: agree, neutral, and disagree. Did the hour format make it easier to understand? 82% agreed. 18 out of 2 were neutral, or 18 or 2 were neutral, and then 0 disagreed. Training was helpful, and we'll use techniques I've learned. 100% or 11 of 11 agreed. So I felt like that was significant. And remember, these are people I've never even met before, and I'm bearing my heart and soul in this project. I'm putting so much work into, and then they're actually learning stuff. I'm like, whoa. And then 82% or 9 out of 11 agreed that they felt more prepared to work with children who have experienced trauma. So that's 82%. And this is from an hour training. And I'm comparing this to training, our next smallest trauma training is 6 hours in the Omaha area. And so that's a big thing. We can accomplish a lot in an hour, but we gotta stay focused. So some of the limitations, feedback and improvements, sample size. So of course 11 isn't a ton of data gathered, but from that I was asked to train our whole foster care department. So that was just initial families, and now I've kind of moved on to train it to all of our adopted and foster care families. And I've actually been invited to train staff at another agency that's bigger than ours in Omaha. And then also with that, will most likely lead to an opportunity to train their foster parents. So I've already done our whole foster care program, and that went really well. But I didn't get to sit that in the data because it was after everything was due. I was trying to get everything done. You know? But the results were the same on the survey. They were very similar, you know. So, and then also the opportunity to train in our post-adoptive services, which is a separate program within our agency. So one of my other limitations is the ability to replicate. I have a very personal connection to the material, and so I'm able to share a lot of personal experiences and a lot of, you know, some of that destitution and loss and trauma, you know, kind of help it make sense to people who haven't been there or don't really fully understand it, and kind of how to retrain the brain to think about things a little bit differently. And so finding somebody to carry on this training or help out with it or do it if I couldn't continue, that's going to be a real challenge, because I'm going to have to really find someone who can connect with the material, because I think that's a major component in its effectiveness. So the hour-long challenge, lots of ground to cover. I'm always going to be on the hunt for what I can consolidate, what I can simplify, and restructure the materials. The reality is an hour is such a limited time, but I am so going to stick to that. Sherilyn, you can't change my mind. Nobody can change my mind. It's got to be an hour, because everybody's always saying, oh, you should do this, you should do this. And then I'm figuring out what I have in there, and I have to prioritize and figure out exactly what, but it has to be an hour. I want that kinship parent who doesn't have time, who can't even get off work, you know, to go spend 6 hours to have an opportunity to take this training, you know, who doesn't come to their foster care agency's trainings. I want those foster parents that are super busy that already go to 1,000 trainings, or those professionals. This is for them. This is for these people, and this is introductory. You know, this is just the basics. If you want to go learn more, by all means, I'm encouraging people to go take the 6-hour training. This is just to get your feet wet, have you start thinking about, you know, some of the issues that can come up. So I need 2 surveys. I figured that out. The retrospective surveys, I noticed that the professional ones are very skewed because I only have 1 survey. You know, that makes sense though. So, because if you're measuring people's knowledge means you're not getting an accurate picture. You have professionals in the room who know a lot more than the average person. So my follow-up, I need to develop a follow-up survey to assess the impact of the training. And so, like I said, I have a little basic model, a very simplified one, and coming up with seeing if people are using it. So following up. So I also need to develop a worksheet that guides people through the framework and the training. And so this would just be something that people who take the training, I can give to the agencies that I'm working with. And here you go, take this worksheet. You're going through a crisis. You can do this trauma worksheet afterwards to process. So the overlap. So there's a continue to engage stakeholders within the agencies or within the agency. Identify ways to prime participants for further exploration. Promote attendance of more in-depth trauma trainings, and be direct about being an introductory refresher when promoting the training. And so this is the big thing. I don't want to overlap with post-adoptive services. So I want to get everybody involved. And I'm very low on the totem pole of my agency. I mean, I'm not a supervisor. I don't supervise anybody. All of this work that I've been doing is just through my connections, my influence, and my networking, and you know, the people that I've connected to within Omaha and within our own agency. And so there's already a lot of buy-in from that, because because it could be because I'm a transformational leader. I don't know. I don't want to keep my own horn. I don't want to keep my own horn. But there are a lot, I'm very respected at my agency. There are a lot of people that trust and value my input, you know? So I don't want to give myself that label, but if somebody else wants to, that's fine. So if professionals and caregivers in the child welfare system receive more effective, efficient, and accessible training regarding trauma and attachment, will it improve their trauma competency or trauma IQ? And it says, yes, we can. So this training, even just a small portion that I did, I can see that it's impactful. You know, these weren't margins of error. These numbers weren't something that I would think, oh, maybe this is just a fluke. I really, you know, I went into it not knowing what to expect and really not expecting to, you know, have it have such a huge impact. But then when it did, I'm like, whoa, we might be onto something here. Hour-long training. Because who zones out after an hour anyways? You know, you're only you progressively get less out of training the longer it is. Unless it's a summit like this. So the collaborative work, so utilizing my professional network, how MLPD changed me. So collaborative work, being able to work with all these different departments, different people within the community, kind of putting all this stuff together. Awareness of minority issues, so it really galvanized some of the knowledge about disproportionality in my community and racial awareness. So just kind of got me thinking about a lot of that, and so that's a whole nother tangent. But you know, it's always been something I've been disconnected with my community, and so that kind of helped me think about it. Really start asking these questions, and really start thinking about what my racial identity and how that fits into my life. Being adopted by a white family and not speaking Spanish, I've always felt separated, but then I also have always looked different than, you know, so it's kind of like I've experienced both worlds and kind of figuring out where I fit in and all that. So using leadership to have a larger impact, being proactive in identifying and addressing issues, making a conscious effort to be a transformational leader, exploring more effective ways to advocate, educate, and support by being a transformational leader. Use strengths to create action, so opportunity to further research, something I'm passionate about, and connect the dots between my professional and personal experience. So I really appreciated the opportunity to put this together because this is my passion and this is what I was doing all the time anyways. And now I've got a name for it, and now it's structured, and now I can give it to the world. Instead of one foster parent at a time, maybe I can do 10 foster parents. And this program allowed me to explore in depth, creating a vision and strategy to improving trauma-informed care. So I like that it pushed me to go a step further. And then here's a good quote: foster care and adoption is about giving. Children in the system experience a tremendous amount of loss of safety, loss of control, and loss of belonging. It's so easy to take things away from difficult children and perpetuate this pattern of loss. What's harder is to give back to these children every chance you get. In the end, this is the difference between a child who has nothing to lose and a child who has everything to gain.